Welcome to the Deep Dive. Today, we're embarking on a really extraordinary exploration. We're diving into sources that, well, they span everything from a groundbreaking AI health assistant
Yeah.
all the way to the profound nature of free will.
And the global superbug crisis, right? Plus some pretty mind-bending theories about reality itself.
Exactly. It's a custom deep dive, really, crafted specifically for you, our curious listener. The goal is to unearth those crucial nuggets of knowledge and maybe some surprising insights from what's a truly captivating collection of articles and research.
Yeah, our journey today is all about connecting some seemingly disparate ideas. We'll show you how cutting-edge advancements in AI are, maybe quite unexpectedly, drawing on ancient wisdom,
Huh, interesting.
and how our understanding of consciousness might subtly influence public health, and, why a tiny microbe could pose one of humanity's biggest threats. It sounds disconnected, but we'll try to link it up.
Okay, so our mission is clear then.
Okay.
Cut through the noise, offer you a genuine shortcut to being truly well-informed on these, let's face it, intricate topics.
Yeah, they are complex.
And leave you with some seriously compelling ideas to ponder. Okay, let's unpack this.
Yeah.
So we're kicking off our deep dive with Dr. Maya. It's an AI health assistant app that seems poised to, well, maybe revolutionize patient care.
Mm-hmm.
Its core aim, as I understand it, is to empower you, the user, to make truly informed decisions and navigate that sea of misinformation out there.
Which is huge.
And ultimately, the hope is it eases the strain on our healthcare systems.
Right. And what's really compelling here, I think, is how Dr. Maya's unique approach, this color-coded 3-symptom triad system, fundamentally contrasts with so many existing symptom checkers.
How so?
Well, those often analyze single symptoms one by one, or they rely on really simplistic yes-no flowcharts. And the research shows pretty clearly, actually, this leads to alarmingly high false positive rates.
How high are we talking?
Sometimes 30 to 50%, at quite low accuracy, too, often just 19 to 54%. Dr. Mia, by looking at patterns, aims to sidestep those pitfalls entirely.
That multi-symptom integration and pattern recognition, that sounds like a significant leap. It's almost as if it mimics the diagnostic process of, like, an experienced physician.
Exactly.
And what's fascinating, you mentioned this connection earlier, is that the sources reveal this approach actually aligns with ancient medical principles. Is that right?
Precisely. This is where the ancient wisdom really shines through. The Charaka Samhita, an ancient Indian medical text dating way back to 1500 BC, emphasized something called tridosha, pattern recognition.
For dosha.
Yeah. It's this holistic approach where health is seen as a balance of 3 fundamental life energies. They call them vata, pitta, and kapha. It's all about understanding how symptom combinations interrelate, not just looking at isolated signs.
Oh, okay.
So this historical validation of a multi-symptom approach, it provides incredible sort of philosophical backing for Dr. Maya's methodology.
It makes so much sense when you put it like that. And this is just theory, right? The sources highlight the extensive clinical experience of Dr. Kadiali Srivatsa, the mind behind the app.
40 years of medical practice.
Wow. And he even developed an early tool called a pediatric assessment tool way back in the 1980s.
That's right. And that tool trained junior doctors to combine symptoms, to distinguish between common stuff and, really serious illnesses. It sounds like a clear precursor to Dr. Maya's core idea.
Okay, so his experience really informs the app's design, aiming to address these critical gaps in current systems.
Definitely. For instance, the research did identify some, let's say, inconsistencies within Dr. Maya's own protocol about handling single symptoms.
Yo.
Yeah, it stated never give medical advice for single symptoms, but then it also seemed to offer advice for one red only or one yellow only. So refining this for a clear, consistent policy.
Makes sense.
Maybe expanding the self-care advice or always prompting for more symptoms, that would make it even more robust.
So it's about continuously refining the system. The sources also point out the importance of expanding its risk assessment beyond just basic filtering to specifically include more vulnerable populations, like the geriatrics, so over 60 or 65.
Right. Pregnant or recently pregnant women.
Immunocompromised individuals, people with chronic conditions like diabetes or heart disease.
Exactly. Those groups need specific consideration. And linking its color-coded advice to establish medical triage levels, like the Australian triage scale, the ATS, that would really enhance its utility.
How would that work?
Well, for instance, for 3RD symptoms, reinforcing the advice like call 999 and go to the hospital immediately. Do not drive yourself. Maybe adding specific specific examples of life-threatening conditions could provide crucial clarity in those really critical situations.
Got it. And ensuring the communication style is flexible seems key, too.
Absolutely. Patients prefer different levels of detail, right?
Yeah, definitely.
So an initial simplified response, but with an easy option for more details or a medical explanation that would cater to diverse health literacy levels. It's about delivering clarity without, overwhelming anyone.
Right. Makes sense.
But ultimately, the sources really emphasize the need for rigorous clinical evaluation. They're calling for pilot studies, or even better, randomized controlled trials, to truly validate Dr. Maya's effectiveness in real-world settings.
Plus ongoing quality checks.
Yeah, coupled with continuous quality assurance through feedback from healthcare professionals and ongoing usability studies, that cycle of improvement is crucial.
Okay, so this whole discussion of Dr. Maya's mission to empower patients, break down these knowledge monopolies, it naturally leads us to a deeper, maybe even more thought-provoking question.
Which is?
How much control do we truly have over our choices to begin with? Our sources now take us into the fascinating realm of free will, and it challenges the very idea that we are the sole authors of our thoughts and actions.
It's a provocative idea, for sure, that our choices often just arise unconsciously, shaped by conditioned thought loops, past experiences, emotional triggers, rather than pure conscious intent.
Like, give me an example.
Well, consider something simple. If you feel unwell, and try to choose a symptom to describe it, did you consciously choose which symptom popped into your head first, or which ones to ignore?
Probably not. No.
The sources suggest these processes are far more automatic than we tend to assume.
It's like that analogy. The thundercloud doesn't decide where the lightning goes. It's just the source. Our brains are these complex storms of neurons, and intentions are just flashes within that storm.
That's a good way to put it.
And there is that chilling example of Charles Whitman. He wrote a suicide note asking for an autopsy because he believed he was compelled by unusual and irrational thoughts before his violent rampage.
And they found a brain tumor, right?
Exactly, which starkly highlights how something physical in the brain can influence behavior. It raises this profound question. Where do we even draw the line between a diseased brain and a normal one, if all behavior ultimately results from brain activity shaped by genetics and environment?
It gets very blurry very quickly. Yet, despite these philosophical challenges, the belief in free will is seen as absolutely essential for society's functioning.
You mean for things like morality, justice?
Exactly. Morality, our justice systems, even just interpersonal trust. But what's intriguing is that the sources suggest letting go of the absolute belief in free will can actually be, well, a kind of gift.
A gift? How?
It can apparently lead to more compassion for others and maybe less self-torment over our own perceived shortcomings or mistakes. A bit more acceptance, perhaps?
Huh. Okay. And this is where the implications really deepen, because our sources connect this philosophical concept of free will directly back to Dr. Maya.
Right. They argue that traditional healthcare models can often create this sort of manufactured dependency.
By withholding information.
Yeah, by intentionally withholding information sometimes, making unilateral decisions, and kind of reducing patients to passive recipients of care.
Okay, I see.
Dr. Maya aims to fundamentally depart from that kind of control-based healthcare model. By providing transparent, accessible information through its intuitive, color-coded system, it actively preserves and enhances free will. It essentially breaks down what has long been a knowledge monopoly.
So it's really about empowerment, not coercion. The sources emphasize that Dr. Maya teaches you to understand your own body, to distinguish between what's truly serious and what might be minor.
Which in turn can reduce unnecessary interventions.
And democratize healthcare access, right? Regardless of your economic status or where you live.
Precisely. And this aligns beautifully, according to the sources, with ancient Hindu principles.
Oh, interesting. Like what?
Well, the Rig Veda's teaching, truth is one, sages call it by various names, suggests these universal ethical imperatives underlying human existence. Concepts like Dharma Raja emphasize the duty to protect all subjects, including from disease and suffering, and this fundamental belief that health is essential for human potential.
And perhaps the most profound connection mentioned is Krishna's teaching. Love me, but do not surrender your free will.
Meaning divine guidance might be available, but humans must exercise their autonomy, their own choice.
So Dr. Maya in this context becomes what the sources call digital dharma, providing crucial knowledge without forcing decisions, truly empowering you to make informed choices for yourself.
A tool for autonomy, essentially.
Right. Now, while Dr. Maya offers this glimpse of empowering individual health, Our sources also remind us of a collective health crisis that looms incredibly large, challenging humanity's survival.
Yeah, antimicrobial resistance, or AMR.
This isn't just some abstract scientific problem. It's a public health emergency that, as the sources point out, was here long before COVID-19 ever hit.
And the numbers, they are stark. They make this threat really tangible. AMR is responsible for approximately 35,000 deaths in the United States each year,
And globally.
a staggering 700,000 globally. And the projection for 2050, it's a catastrophic 10 million annual deaths.
10 million. That's hard to even comprehend.
To put that in perspective, that's roughly the population of a major city disappearing every single year. The World Health Organization rightly calls it one of the most urgent health threats of our time.
And it's not just about antibiotics, is it? We're seeing similar problems with antivirals, antiparasitics, antifungals.
It's across the board. Antivirals for HIV, antiparasitics for malaria, antifungals for dangerous infections like Candida auris. It's a multi-front war. And get this, Alexander Fleming, who discovered penicillin,
Yeah.
he actually warned about this potential problem way back in his 1954 Nobel Prize address. He predicted bacteria would develop resistance.
Wow. He saw it coming. How do they actually do it? How do bacteria become resistant?
Well, they're incredibly adaptable. They can mutate their existing genes, or they can acquire new resistance genes through something called horizontal gene transfer.
Which is like bacteria sharing cheat sheets.
Kind of. Think of it as bacteria sharing genetic blueprints. This happens through a few mechanisms. Transformation, where they just grab free-floating DNA from their environment. Transduction, where viruses act as delivery trucks for genes. And conjugation, which is like a direct docking and DNA transfer between two bacterial cells.
Okay. And fungi.
Fungi are a bit different. They often develop resistance through specific gene mutations, like in a gene called ERG11, or by basically turning up the power on drug efflux, pumps these things that pump the drug right back out of the cell before it can work.
Clever little things.
Yep.
And parasites are in on this evolutionary arms race, too.
Oh, absolutely. Resistance to drugs like ivermectin, used for parasitic worms, has been linked to things called ABC transporters again, tiny pumps pushing the drug out. And for some older drugs, like diethylcarbamazine for filariasis, we don't even fully understand how they work, which makes combating resistance incredibly challenging.
So a significant and maybe often overlooked aspect here is the role of reemerging infections.
Yes, exactly. Many of these actually present with distinct cutaneous or skin signs that can be really crucial for early diagnosis.
Like what?
For instance, Staphylococcus aureus, including the infamous MRSA, can cause red blisters and boils. If it gets into the bloodstream, it can become life-threatening very quickly. Syphilis, caused by Treponema pallidum, initially presents with a painless chancre, a very specific sore.
And the sources list so many more examples, showing how broad this issue is. Rickettsia causing Rocky Mountain spotted fever, fungal infections like blastomycosis.
Even something called rosebush mycosis from sporotrichosis. You can literally get it from rose thorns.
Wow. And we're also seeing the reemergence of viral infections like measles that causes immune amnesia.
Yeah, that's a scary one. It can impair immunity you previously acquired, making you vulnerable to other infections. And varicella zoster virus, the one causing both chickenpox and shingles, these aren't gone.
Which brings us to a really crucial point, the sources stress. It is better to prevent than lament.
Absolutely. They highlight the paramount importance of public health measures and, of course, vaccines. The irony of the COVID-19 pandemic is that it led to over 80 million children missing routine vaccinations worldwide.
And that directly contributed to the highest measles deaths in 23 years.
Directly. It's a stark reminder of the long-term ripple effects these health crises can have. We can't neglect routine prevention.
So the solution isn't just about finding new miracle drugs. It's also about implementing smart strategies with the tools we already have.
Exactly. Things like antibiotic stewardship.
Yeah.
That focuses on using the right drug at the right dose for the right duration, using timeouts after maybe 48, 72 hours to reassess if the antibiotic is actually needed or working.
Right, preventing unnecessary use.
And there's also this concept of refugium for anti-helminthic resistance. That's resistance in parasitic worms. The idea is to deliberately leave some parasite populations unexposed to treatment.
Why would you do that?
To slow down the development of resistance. By keeping some susceptible parasites around, you reduce the selection pressure favoring the resistant ones. It's counterintuitive, but smart.
Okay. And we're seeing actual innovations too, right? Like phage therapy.
Yeah, that's a really interesting area. Using bacteriophages, these are viruses that specifically target and kill bacteria to treat infections like MRSA or even things like acne-causing bacteria.
And new drug delivery methods, nanoparticles.
Using nanoparticles to deliver drugs more precisely where they're needed in the body, potentially improving efficacy and reducing side effects. Lots of research happening there.
Now, this whole superbug crisis,
Hmm.
it's something deeply personal for Dr. Srivatsa, the creator of Dr. Maya, isn't it?
It really is. The sources reveal his first encounter with MRSA was back in 1989. He witnessed a 14-year-old boy die from it, and that profoundly shaped his lifelong mission to prevent similar tragedies.
He even titled a keynote address, The Elephant in Doctor's Room, to highlight this often overlooked threat.
Yeah, he's been a very vocal critic of overprescription, especially giving antibiotics for viral infections where they do absolutely nothing.
Except help bacteria build resistance.
Exactly. And he's criticized the misuse of protocols that might inadvertently contribute to resistance spreading quickly through society. His experiences really underscore the devastating impact of uncontained outbreaks, seeing healthcare workers fighting diseases with no known cure, facing isolation, emotional suffering.
And this directly connects back to the Dr. Maya app.
Absolutely. It's why his app emphasizes community-based early detection and voluntary isolation for infectious symptoms. It's a proactive strategy. The aim is to reduce those secondary attack rates by potentially up to 40% and bypass expensive traditional infrastructure, focusing on empowering individuals right at the community level.
Okay, so from the microscopic threat of superbugs, we're now moving to our final and maybe most fascinating realm. Our sources truly stretch the imagination here, diving into the very fabric of reality itself.
Yeah, get ready. This touches on concepts that profoundly challenge our everyday perceptions of existence.
Like the Boltzmann brain, what is that?
Okay, so imagine a highly organized, conscious structure like a brain that spontaneously forms just through incredibly random processes in a vast, chaotic universe.
Just pops into existence.
Theoretically, yes, it's wildly, wildly improbable. But if the universe is infinite or lasts forever, even the improbable might happen. Now, if you were one,
How would I know?
exactly, it would be incredibly difficult, maybe impossible, to distinguish between real, continuous existence and this fleeting, illusory existence, because a Boltzmann brain would likely be filled with completely false memories of a past that never happened.
Whoa. Okay, that makes you question everything.
It really does. And then there's this mind-expanding connection between quantum entanglement.
Where particles stay linked no matter how far apart.
Right. Measuring one instantly affects the other. That weird link connected now with the holographic principle.
Which suggests our 3D reality is like a projection.
Kind of, yeah. Like information stored on a distant 2D surface projecting our reality. Putting those two ideas together, some theories propose that space-time itself might be constructed from these degrees of entanglement,
Meaning?
meaning that disrupting the entanglement could actually change the very structure of space-time. It's not just a background stage, it's built from these quantum connections.
That's hard to wrap your head around.
It definitely takes us far beyond speculation. It offers a potential framework, though, to understand these deep connections between quantum information, gravity, and space-time. In this view, space-time isn't smooth and static, but dynamically shaped by entanglement, maybe forming tiny physical bridges at the smallest scales.
Wow, okay. We also learned about the butterfly effect. That comes from weather prediction, right?
Yeah, Edward Lorenz's work in the 1960s. It profoundly challenges the old deterministic view of the universe, the idea that if you knew everything perfectly, you could predict the future perfectly.
Because tiny changes have huge effects.
Exactly. Even the smallest, imperceptible uncertainties in initial conditions, like the flap of a butterfly's wings, metaphorically can grow exponentially, leading to entirely different, vastly unpredictable outcomes down the line. It means perfect prediction is practically impossible.
Which echoes the complexity we see in health and life in general.
Definitely. And speaking of unseen complexity, the sources touch on the idea of hidden dimensions.
Going back to Kaluza's theory from the early 20th century.
Right, where Einstein's equations of general relativity could actually be written for 5 space-time dimensions, not just 4. The 5th one being curled up so infinitesimally tiny that it's invisible to us.
So these extra dimensions could be literally everywhere around us, but just too small to observe.
That's the idea, and their geometry, how they're curled up, might even determine the kinds of fundamental particles that exist. It makes you wonder what else is unobservable but still shaping our reality.
It really does. Finally, the sources explore consciousness itself, not just as an observer.
No, suggesting it might actively shape physical reality at the quantum level. This completely redefines its relationship with time and the universe.
How so?
Well, it proposes that consciousness, maybe as it transitions, perhaps at death, though the sources are abstract, might integrate into some kind of universal consciousness and continue to exist beyond our typical perception of linear time and individual being.
Deep stuff.
Wow.
And even more locally, modern neuroscience and cultural studies suggest that space and time might not even be universal objective concepts.
Right, but rather tools organized by the human mind, profoundly shaped by our neurological mechanisms and the specific cultural context we develop within. How we perceive time and space might not be how reality is, but how our brains construct it.
Okay. Wow. This deep dive has truly taken us on quite a journey, hasn't it?
Okay.
I mean, from empowering health insights using AI rooted in ancient wisdom,
To the profound implications of free will and our choices.
the urgent global threat of superbugs.
And yeah, even questioning the very nature of reality itself. We covered a lot of ground.
It really did. What stands out most to you from all this?
You know, what keeps popping up for me is this recurring theme of pattern recognition across all these different topics.
I mean,
Well, whether it's Dr. Maya's multi-symptom approach looking for illness patterns, or the philosophical idea of conditioned thought loops shaping our behavior patterns, or even the scientific understanding of complex systems like the butterfly effect revealing hidden patterns, recognizing patterns seems absolutely key.
key to understanding, and maybe key to navigating the world.
Exactly.
And it highlights how knowledge truly is power, doesn't it? The ability to discern, to understand these unseen forces and systems at play, whether it's the nuances of free will, potential hidden dimensions, or the subtle spread of resistant microbes.
It empowers us.
It empowers us to make better decisions for ourselves and, hopefully, for humanity. Dr. Srivats's vision, as we explored, is precisely about empowering you, the listener, to control what happens next in your health journey.
Which raises, I think, an important final question to leave people with. If knowledge and early recognition, this pattern finding, are so crucial, and if our reality might be shaped by unseen forces, maybe even our own consciousness, what further hidden insights could be unlocked? What could we discover if we applied the same depth of inquiry, the same search for patterns, to understanding ourselves and our collective well-being, both, personally and maybe even cosmically?
It certainly gives you something to mull over, a lot to think about. We hope this deep dive has offered you a fresh perspective and maybe a shortcut to being truly well-informed on these incredible, complex topics. Until next time,
Keep digging.
keep digging for those nuggets of knowledge.